Radioactive traces are isotopes used to observe the movement of certain materials in chemical, biological, or physical processes. One valuable use of radioactive traces is in medical diagnosis. Click the Method button to see how this is achieved. One particular use of radioactive traces is to diagnose problems with the kidneys and urinary system. The patient is injected with a trace of a gamma-emitting radioisotope, and an image of their urinary system is recorded by the gamma camera. Click the Inject Radioisotope button. After a short time, the radioisotope enters the kidney via the blood from the renal artery. It is filtered from the blood in the kidneys and stored in the bladder. Here we see a sequence of gamma camera images of the urinary system for two different patients. Note that artificial coloring has been applied to enhance the images. Click the play button for each image. Which patient has a possible obstruction or dysfunction in their kidney? Answer: the images indicate that patient B has a problem with his right kidney. After 35 minutes, we can see that the radioisotope is still present in the kidney, indicating a possible obstruction or dysfunction. Technetium-99m is often used in medical tracing and imaging because it has a half-life of 6 hours. Why is the short half-life advantageous? Answer: the short half-life minimizes the radioactive dose received by the patient. After 24 hours only, 1/16 of the technetium will remain. The radioisotope is also excreted by the patient, lowering the exposure further. In industry, radioactive tracing can be used to detect leaks from underground pipes. Here we see an oil pipe in which the oil has been mixed with a small trace of a radioactive isotope. The isotope chosen is a beta emitter, so it can be detected at the surface. It also has a short half-life, so it will not cause any long-term environmental damage. Drag the radiation meter along the surface of the ground. Notice how the reading is a maximum above the leak. Summary: radioisotopes can be used as traces.